Ovarian cancer is an oncological disease. Look at this picture, shows that ovaries, CT findings and MRI findings. Look at this. Introduction. Ovarian cancer is a malignant tumor that originates from the ovaries, part of the female reproductive system. It is often referred to as the silent killer because symptoms may be subtle and not noticeable until the disease has advanced. Ovarian cancer is the fifth leading cause of cancer-related death in women, but early detection can significantly improve prognosis. Definition. Ovarian cancer is the abnormal growth of cells in the ovaries which have the potential to invade or spread to other parts of the body. There are different types of ovarian cancers which can arise from the different cell types in the ovaries. Types. A. Epithelial ovarian cancer. The most common form, originating from the surface epithelium of the ovary. It accounts for 85 to 90% of all cancers. 1. Serous carcinoma, most common subtype. 2. Endometrioid carcinoma. 3. Mucinous carcinoma. 4. Clear cell carcinoma. B. Germ cell tumors arise from the cells that produce eggs. 1. Dysgarminoma. 2. Teratoma. 3. Yolk sac tumor. C6 cord stromal tumors arise from the connective tissue cells that produce hormones. 1. Granulosa cell tumor. 2. Serotioid lining cell tumor. Causes of ovarian cancer. The exact cause of ovarian cancer is not fully understood, but several factors may contribute to the transmission of normal ovarian cells into cancerous cells. 1. Genetic mutations, especially mutations in the BRCA1 and BRCA2 genes. 2. Hormonal imbalances. High levels of estrogen may increase the risk. 3. Chronic inflammation. Inflammation in the reproductive system may trigger abnormal cell growth. Risk factors. 1. Age. Most ovarian cancers develop after menopause, and half of all cases are found in women aged 63 or old. 2. Family history. A strong family history of ovarian or breast cancer increased risk. 3. Inherited genetic mutations. BRCA1, BRCA2, Lynch syndrome genes are linked to higher risks. For reproductive history, women who have never been pregnant or had fertility treatment have a higher risk. 5. Hormone replacement therapy. Long-term use, especially estrogen-only therapy. 6. Endometriosis. This condition is associated with an increased risk of certain ovarian cancers. 7. Obesity, linked to a higher risk of developing and dying from ovarian cancer. Complications. 1. Metastasis. Ovarian cancer can spread to other organs such as the liver, lungs, and lymph nodes. 2. Ascites. The accumulation of fluid in the abdomen causing bloating and discomfort. 3. Bowel obstruction. Cancerous growths can block the intestines. 4. Pleural effusion, fluid accumulation around the lungs leading to difficulty breathing. 5. Cachexia, severe weight loss, muscle wasting, and fatigue, often seen in advanced stages. Pathophysiology. Here is step-by-step process of how ovarian cancer develops and progresses. Step 1. DNA mutation in ovarian cancers. Impact. These mutations affect tumor suppressor genes, causing dysregulated cell growth. Step 2. Loss of normal cell cycle control. Impact. Abnormal cells start dividing rapidly, forming a small mass of cancerous cells in the ovary. Step 3. Tumor growth in the ovary. Impact. As the tumor grows, it may invade nearby ovarian tissue and cause localized symptoms like bloating or pelvic discomfort. Step 4. Inversion into nearby structures. Impact. This inversion leads to more noticeable symptoms such as abdominal pain, changes in bowel habits, and urinary frequency due to pressure on surrounding organs. Step 5. Shading of cancer cells into the peritoneal cavity. Impact. This leads to widespread cancer dissemination within the abdomen, a characteristic of advanced ovarian cancer. Step 6. Development of ascites. Impact. Ascites cause abdominal distension, discomfort, shortness of breath, and digestive issues, a common complication in advanced ovarian cancer. Step 7. Lymphatic invasion. Cancer cells may invade nearby lymph nodes, particularly those in the pelvic and para-aortic regions. Step 8. Hematogenous spread. Impact. Distinct metastasis significantly worsen the prognosis and can lead to life-threatening complications such as organ failure. Step 9. Formation of new blood vessels. Impact. Angiogenesis helps the tumor grow and allows it to spread further, as the newly formed blood vessels provide abdominal pathways for cancer cells to enter the bloodstream. Step 10. Systemic effects. Impact. Cachexia significantly reduces quality of life and increases mortality in patients with advanced ovarian cancer. Signs and symptoms. Early stages. Symptoms are often vague and can include 1. Abdominal bloating and swelling. 2. Pelvic pain and discomfort. 3. Early satiety, feeling full quickly. 4. Frequent urination. Advanced stages, more pronounced symptoms like 1. Unexplained weight loss. 2. Fatigue. 3. Changes in bowel habits. 4. Shortness of breath. Diagnosis. 1. Pelvic exam. Physical examination to feel for masses or abnormalities in the ovaries. Imaging test. 1. Ultrasound. 2. CT scan MRI to detect tumor size and spread. Blood test. 1. CA-125, a tumor marker that is elevated in many ovarian cancer patients, although not specific. 2. Biopsy, surgical removal of tissue for histological analysis. 3. Laparoscopy, minimally invasive procedure to visually inspect the ovaries and take tissue samples. Nursing diagnosis. 1. Acute pain related to cancer progression or treatments side effects. 2. Imbalanced nutrition related to anorexia nervosa and abdominal distension. 3. Anxiety related to diagnosis, treatment and prognosis. 4. Risk for infection due to immunosuppression from chemotherapy. 5. Fatigue related to cancer and treatment effects. 6. Body image disturbance related to physical changes after surgery or treatment. Management. 1. Surgical management. Cytoreductive surgery, removing as much of the tumor as possible. Oophorectomy, removal of one or both ovaries. Hysterectomy, removal of the uterus, doubling surgery for advanced cases to reduce tumor load. To chemotherapy, platinum based drugs like carboplatin and paclitaxel are commonly used post surgery to kill remaining cancer cells. 3. Targeted therapy drugs like PARP inhibitors are used for cancers with PRCA mutations. For radiation therapy, less commonly used but may be applied in certain cases to target residual cancer cells. 5. Supportive care, managing side effects such as nausea, pain and fatigue. Treatment. 1. Surgery. The primary treatment for ovarian cancer is surgery, which involves removing the tumor. 2. Chemotherapy. After surgery, chemotherapy is often used to kill any remaining cancer cells. 3. Targeted therapy. Drugs like PARP inhibitors target specific mutations. 4. Radiation therapy. They are not commonly used in ovarian cancer. 5. Hormone therapy. In certain cases, especially for less common ovarian cancers. 6. Immunotherapy. In some experimental or advanced cases. 7. Palliative care for advanced stages. Psychosocial medicine. 1. Emotional support. Patients with ovarian cancer often face anxiety, depression and concerns about body image. Providing counseling and support groups is important. 2. Fertility concerns. Younger women may be concerned about the impact of cancer treatment on their fertility, necessitating discussions about fertility. Preservation. 3. Quality of life. Palliative care may be required in advanced cases to ensure the patient's comfort and address physical and emotional symptoms. Prevention. 1. Genetic testing and counseling for women with family histories of ovarian or breast cancer. Testing for BRCA1, BRCA2 or other related gene mutation may guide preventive strategies. 2. Risk reducing surgery. Prophylactic removal of the ovaries and fallopian tubes for high risk individuals. 3. Oral contraceptives. Long term use of birth control pills has been shown to reduce the risk of ovarian cancer. 4. Regular pelvic exams. Monitoring for early signs of ovarian cancer. In conclusion, ovarian cancer remains a challenging disease due to its late presentation and non-specific symptoms. Early diagnosis and comprehensive treatment are crucial for improving outcomes. Advances in genetic testing, targeted therapies, and supportive care have provided hope for better survival rates. Thank you. Have a nice day.